we have seen last very important one young lady. SLE, how it comes in different forms. One patient came with a rate of 36, heart rate, young, 25 years hardly age, from Kalighat. So later on, after full investigation, it was found to be heart block due to the SLE. And we did the double chamber pacing in 2007. And after that, one pregnancy was successful, and second pregnancy she has undergone in recent past. So SLE presented with sometime heart block here in hospital Alvea. So many cases it presented. One lady, I remember 2003, we have transfused more than 8 to 10 bottle of blood transfusion several times. But her husband was basically very frustrated later on. And we have sent to Dr. Malay Sen, very famous hematologist, and even we were not able to diagnose, pinpoint what was the diagnosis. And after 2.5 years after that, it was found to be positive for him, and it was AIHA, indirectly evidence of this SLE. That lady is still having now all right. So SLE is such a disease, always keep in mind, it is basically one of the important, it is the due course, clinical due course, variety will come. So earlier high level of suspicion with this. We have seen 2-3 cases of DLE, presented with DLE, and then indirectly we having this. So SLE is a multi-system disease, it is a connective tissue disorder, almost involve most of the organ. So always keep the eye open for this.
So toxic drugs, how pregnancy continues then? You are giving so toxic drugs?
No, it was only on Visolol. Patient has been steroid. And
So many
she's
toxic
already
drugs.
Fertility is not affected by the SLE.
Achha.
Yes.
Only the drugs
Yes.
that are cyclophosphamide and or mycophenolate mofetil, they will have specifically endoxan is ovarian failure, and in male there is gonadal problem. Okay. So if somebody wants to go for pregnancy, the drug has to be stopped at least 3 months prior to it. Then only plan for. Otherwise, pregnancy or age has no influence on this SLE.
It is not going to increasing the activity, rather
Reduce.
And
reduce.
again regarding renal transplant, if the renal failure sets in, the immunologic process quiescent. Otherwise, there is no use of going for a transplant. This the immunological process persists. Once renal failure sets in, this immunologic process calm down. Then only there is chance of continuation of the successful transplant. Otherwise, there will be rejection. Yes, there it becomes quiescent. Immunological process becomes quiescent because of the some immunomolecule by the uremia.
So, if one patient, Sarka patient, Dr. D.S. Rai, 1999, patient first he died in ICU. That lady have a very peculiar thing. In 1991, she was having history of SLE, fully treated with one course. And 2008-9 onward, when we did the SLE, all the markers, everything was negative. So I was very much surprised whether it was a positive case in that time or not. Then we have gone for the 2 times PAPs was done in this hospital. Also sent that from Bhatanagar patient. So this type of the changing of clinical behavior, that initially it was SLE nephropathy, fully treated, come to normal, all level, later on developed ischemic cardiomyopathy. We did the angiogram, it was a multivessel diffusely disease. So non-operated, hardly LVO of 35-32%. So 7-8 times recurrent hospitalization with decompensated heart, and later on she died with infection with multi-organ failure. So that was the things sometimes they happen in.
So in the later part, there is a chance of myocardial infarction.
Vasculitis.
That we should be very
It is
careful.
lupus anticoagulant.
It is a multi-systemic disease.
Multi-system.
But acute myocardial infarction is not
But
so much
renal
common
impairment
reported.
renal impairment
Ah,
progresses the
thrombosis
immune
can
immune
Thrombosis is quite common because lupus
Vasculitis, vasculitis.
usual vascular. So apply it to antiphospholipid antibodies to be done must in those cases.
And due to APLA, sir, acute myocardial coronary thrombosis can happen. That is the
था तो DLE का, तो क्या हम लोग उसको ब्लड लेंगे कि नहीं? नहीं ना।
This is not an ideal donor. Ideal donor.
आइडिया
Rather
तो
we have
नहीं
to
है।
avoid.
ले सकते हैं कि नहीं? मैं तो नहीं
No,
ले
no, it should avoid.
हाँ, it should avoid because
Everything you are saying
autoantibody is there.
your blood donation.
So don't take, that is not ideal. Any donor's definition is a very clear cut. और any question में बोलिए पूछिए सर. अभी we are having 10 minutes more.
नहीं नहीं 10 questions है क्वेश्चन.
Someone? Just one announcement. Tomorrow we are going to have a